It's without a doubt that COVID-19 has wreaked havoc in the world, and one of the things that has been severely affected is our neglected tropical disease programs worldwide, and particularly in Africa. We've had to, as part of the focus on social distancing, we've had to stop most of the mass drug administration programs in Africa. And so the idea is now to think about when we go back post-COVID, how are we going to do our programs? What is the way that we're going to do our programs better? Are there innovative ways that we can actually carry out these programs where people can be treated safely and not necessarily through mass drug administration, but making sure the safety of the people being treated and the safety of the community health workers who are treating them. So that is the discussion that is ongoing, but we have still, as WHO issued guidance, that all programs that involve any kind of mass drug administration should be halted. And as a follow-up to that, there are diseases which require treatment, immediate treatment, diseases like leishmaniasis, which are also part of the neglected tropical disease group. And those diseases, people are still required to go to health facilities and get the requisite treatment. Thank you.
Many thanks, Dr. Malecela. So for Simon, if you can't see it, but we will send you, it's Dr. Mwele Malecela, Director of WHO Program for Neglected Tropical Diseases. We will go now to Globo, Brazil, Bianca Gauthier.
Hi, Tarek. Can you hear me?
Yes, very well.
Thanks a lot. My question is to Dr. Mike Ryan. How do you see the situation in Brazil now? Do you think the number of deaths has stabilized? Do you see any sign of stabilization? And if so, what does it mean exactly? What signs it can give us? Thanks.
Yeah. Is this not working? It's working now? Okay. Yeah, I think the epidemic is still quite severe in Brazil. I believe health workers are, as we've said before, working extremely hard and under pressure to be able to deal with the number of cases that they see on a daily basis. But certainly the rise is not as exponential as it was previously. So there are some signs that the situation is stabilizing, but we've seen this before in other epidemics in other countries. You can see a sign of stabilization for a day or a few days, and then the disease can take off again. So what I would say is it's a moment of extreme caution in Brazil. There needs to be a focus on physical distancing, on hygiene, on reduced crowding, and being able to support populations, particularly populations from ethnic minorities, for people living in difficult conditions in urban environments and poorer conditions. It's difficult for people to do social distancing. It's difficult for people to maintain personal hygiene, and we have to try and support them in that. So it is, I think, from the perspective of Brazil, a moment now to really double down, to really focus on the public health and social measures, to focus on supporting communities who find it both difficult to sustain that and also have a greater impact in terms of health, to ensure that the hospital system continues to function and is able to cope with severely ill patients. If all of that is done, then we would expect Brazil has historically, as I said previously, a proud history of containing and suppressing infectious diseases. And I have no doubt that if the full skill, commitment, ingenuity of the Brazilian state, of the provinces, of the people is leveraged in a united, sustained and combined way, that Brazil will bring this disease under control and will succeed in emerging from this as quickly as possible.
Thank you, Dr. Ryan. Next question is from Mexico. We have Paulina Ancadena from Cancun. Paulina, if you unmute yourself, we will hear you.
Hola, ¿sí me escuchan?
Sí, te escuchamos.
Gracias a todos, gracias Tarek. Quisiera preguntarles, en Cancún y en general en Quintana Roo, entramos en temporada ya de dengue y chikungunya. ¿Pueden estos síntomas mimetizarse y o agravarse con COVID? ¿Qué ventana tenemos para diferenciarlos? ¿Qué es la recomendación que nos pueden dar? Gracias.
Oh, I can start and then others can supplement. So that's a very good question, and it highlights the need to ensure that we have surveillance systems in place for not only COVID-19 but for other pathogens that are circulating. And in fact, this morning I had a call with teams across NTD and my own team looking at arboviruses and looking at dengue and yellow fever and chikungunya and Zika, and how do we accelerate the arbovirus work across the globe in COVID-19? How do we ensure that countries are continuing to fight against other pathogens that exist that are common in many parts of the world, so that not only can we detect cases, but then we can distinguish between who is infected with which pathogens? How does this affect the clinical pathway in terms of what patients need in terms of clinical care, and how we can protect onward transmission within families, within communities? And so this is something that is very important to all of us. We work through our regions, we work through our country offices, we work with the national ministries of health and across different sectors to ensure that these systems continue, that these surveillance systems, and that the medications are in countries that need to be in countries. So I'm not sure if you want to supplement.
I'd just like to add the importance of vector control and how we are actually focusing also on encouraging the personal surrounding vector control that can be done easily with social distancing to continue. So in our guidance, we've also issued the vector control to particularly deal with the Aedes mosquito, which a lot of the time is around the house in little flower pots, etc., should be continued and should be encouraged. Thank you.
And maybe I can just add on this that while dengue, chikungunya and COVID-19 are very different diseases and have different pathways by which they're caused, they're very much fused in one way, and that is that they can attack vulnerable communities. They're very specific to context, to the context of water, sanitation, overcrowding, poverty, the lack of appropriate management of wastewater, lack of access to healthcare for what can be life-saving interventions. There are so many similarities. When a new or an old disease emerges in a community that is not well served by healthcare, that has underlying issues, both social and healthcare issues, these diseases exploit all of those, as the Director General has said many times, the cracks that exist in our societies in terms of social justice, in terms of access to healthcare. Dengue is a very, very good example of that. And I think while they may not be very similar diseases, they exploit very similar weaknesses in our societies and in our health systems. And if we work towards universal health coverage, if we work towards strengthening core health systems, if we work, as you are working so well, on integrated approaches, on primary health care delivered close and within communities for multiple diseases, both in prevention and control, and we move away from over-verticalized approaches and we focus on communities and their capacity to deal with the diseases that threaten them, then I think we'll be doing better in the long run. We have to deal with COVID now as a singular problem. As the DG said, it's a very dangerous disease. But we need solutions in the long run that deal in a more integrated fashion and strengthened, resilient health systems, empowered, educated communities that can access the tools that they need to be able to control disease within their own communities.
Many thanks. Now we will go to Jim from Westwood One. Jim, hello. Do we have Jim? We don't, it seems. So we will go to Jamil. Jamil Chade, working for Brazilian media based here in Geneva. Jamil?
Thank you, Derek. It's just a clarification. What is